So next up to the stage, I want to invite the CEO of Mercy Care, Lorry Bottrill. Lorry, let's have you come on up and give her a round of applause, please. So again, thank you, and thank you for Mercy Care getting wind in our sails and helping us launch this first event. Let me ask you this question to start that I think is one of the most interesting questions that I get to ask people. And the preface is that our attention and our focus is really perhaps the most limited resource in the world today, our attention and our focus. And so what are you spending your mental attention and focus, your mental energy on as you lead Mercy Care?
Thank you. So first, thank you for having us here. And I agree, listening to Kate Brophy-McGee and the amazing insight that she provided. It's really interesting for me to hear her because a lot of the things she's talking about are exactly what we're focused on. And so how amazing that we collaborate together and there's such a community awareness of some of the same items. So I did just want to acknowledge that. As far as mental energy for us, we've actually gone through that same exercise of saying there are so many things that we need to focus on and we realize. So we really worked with our board through Dignity Health and Ascension on really how do we focus on some comprehensive health focus areas, because we want to be everything to everyone, but we're not going to be successful if we continue to focus that way. So a couple of ours, one is addictions overall. So we are spending a lot of time on that. It's not just opioids. While we think that's important, there's alcohol, there's tobacco, there's lots of things. So that's an area of focus for us that we try to dig into. Housing is certainly important, and you heard the senator talk about that as well, and something that is really critical for all of us, and we are really all, I think, understanding that and really coming together as a community to focus on that as well. And Kate Brophy mentioned this too, but school-based clinics. So how do we really get those services into the schools? How do we talk further about suicide prevention and safe talk and things like that we know are really, really important, and unfortunately just a community item that's facing all of us. And so how do we really focus on that as well? And then our last area of focus is really women's health. And so not even beyond the typical kind of mom and baby, but kind of segments of that population where women who may also be homeless who are also pregnant, and how do we get them into care, or they have an addiction or other things. So really trying to zero in on those, because to your point, there's so many things and it at times could be overwhelming. And so how do we take the time to really drill into those that we think we can have the biggest impact on?
Yeah.
So.
Mercy Care has been around a long time, and sort of the model of integration and the relationship between physical and behavioral health has changed over the years here in Arizona.
Yeah.
How would you characterize the sort of post-October 1 period of integration in this last 9 or so months?
Sure.
What has changed? What is different? What maybe caught you by surprise is something you maybe didn't expect?
Sure. So a couple things with that. So for Mercy Care, as you may know, we were the first regional behavioral health authority to have the integrated health for the persons with serious mental illness. So we've been doing that since April of 14. So we have had some experience with that and some insight into that. And so probably a little bit unique along with the other health plans that are REBAs. So when we knew ACC was coming, we probably have a slight advantage in that we were already caring for the behavioral health and the physical health for our members in Maricopa County. So we were able to kind of understand that. I think probably the biggest thing that changed is the way we're kind of paying providers, so that payment. And we knew for our providers there was a lot of work that had to be done, whether that's they really were able to call one health plan, Mercy Care, and work through payment or work through operational things as well, and we were able to kind of leverage that broader relationship. Now that it's divided up for 7, we know that that puts some burden, and so we're certainly doing what we can to make it more seamless for our providers so they continue to focus on the care and less on all the administrative burden. I think across the board it's definitely a learning, so I wouldn't say we even have it all figured out. I think it's only, to your point, 9 months in, but it's not even 9 months. So it's still really new. I think we're still learning from what we're seeing, what's really happening. I don't think we've seen the full impact of it. I know for us, we've really spent a lot of time, and really the great thing in working in Arizona is we partner so well with the providers, the community, and even the other health plans. We all work together very closely, and so we've been able to share a lot of best practices with access as well. And so as things come up, we're just really in that constant dialogue, and I think that ongoing communication is really key as we're continuing to navigate. I think overall it was successful. We didn't have, members falling through and still able to provide care, but not without a little growing pains, and I think we're still working through that as well. So,
yeah. Tell me, the plan-provider relationship is always evolving. Sometimes it's 2 steps forward, sometimes it's 2 steps back.
Right.
You've got very close provider partners and owners. How would you characterize, and maybe give us an anecdotal example of something interesting happening in the plan provider space that may not be commonly known? What's sort of like a real highlight of this evolution that we're seeing from where you sit between plans and providers?
Yeah, so to your point, with lots of different relationships and a lot of, I think on both sides, us trying to understand from a provider perspective and providers trying to understand where we're coming from. So we work with, whether it's kind of an ACO as we evolve in this value-based, but we've also done value-based, whether it's with employment providers and housing providers and SMI clinics and all kinds of things. So certainly really trying to understand that partnership. But I do think some of the probably best collaborations that we've had is around some of our centers of excellence. So I know we have Touchstone here in Southwest Behavioral Health, but around autism, we've really been able to kind of look at that and really create some models that we think are really serving individuals. They've been extremely valuable and certainly in high demand. And I think as we've seen those evolve, really been able to realize kind of that need, and that may be a better way to be serving. As you may know, we just also won the DD contract, which is now moving to that integration of behavioral and physical. So certainly learning from our experience with that Centers of Excellence and how we kind of evolve that while serving statewide with a DD contract.
Yeah.
So
It's a notable win, right? The DD win.
Yeah, it's exciting.
A lot of times we talk about, in state policy and politics, we talk about Medicaid, but tell us about what you're doing in the Medicare space and how that's informing the broader work that you do.
Yeah, thank you. We are. We're really a dual SNP as well, so we don't have a straight Medicare Advantage, but we do have offer an option for our members that are also Medicare eligible. So we have about 20,000 members, and so for us, that I'd say this dual SNP business, and I was talking to someone about this last night, has been an evolving thing and certainly a learning for us. I think I'll just say 10, 12 years ago when Mercy Care got into our Mercy Care Advantage product, I think there was a thought, we can just do it the same way we're doing Medicaid. It's basically the same thing. And there's definitely appreciation very early on that is absolutely not the case. So certainly from CMS, we see where they're trying to go. I've heard someone even mention earlier today the joy of providing care and being a provider, and we hear that a lot from CMS. We actually were awarded a Transforming Care grant from CMS that really focused on that value-based and getting out with the providers and helping them understand it. But we see where CMS is kind of driving things, and I think that also plays out in our Medicaid space. But certainly with the Medicare, there's a slightly different population. I think we heard earlier today the age often of some of the individuals and how they're accessing care and trying to understand that pattern of behavior and needs, which may be a little bit even different than some of our Medicaid population. Obviously, they're duals and often come to us with some, chronic needs that really need to be solved for both on the behavioral and physical side. But I'm really excited about what we're able to do in serving. And luckily, as part of this DD, we're actually expanding statewide for our Mercy Care Advantage, so we're really excited about that as well.
Yeah, good. Some people would say that we're at a period of stasis, that the opportunity to really drive meaningful reforms is narrowing. I want to talk about, let me ask you this question first. Do you feel like that's the case in the hullabaloo of all of the work that you guys are doing across all of these lines of business and trying to get silos to integrate? Does it feel like a time of narrowing opportunity for reform, or does it just feel frenetic?
So from my perspective, I would say we're continuing to get some good traction. I mean, I'm really energized by listening to Kate Brophy-McGee with some of the councils that we're on with the governor's office, the real focus on our Medicaid population, the focus on some of the real things that we're all talking about, whether it's social determinants and housing, opioid, things like that, just to have such a real focus on that, and a kind of the willingness and kind of, to your point, social contract that we all have, and really the time to say, we need to understand this better. We need to figure out what's going on, because this isn't just going away. So I really feel energized by the voice that we have, the interest. I know I've been down at the legislature recently talking about the DD award and understanding the DD population and some of those needs in a rural community, and there's really a strong engagement in trying to understand that. So nationally, you know, where things are going with reform and that kind of thing, at least locally, I'm really energized by the focus and energy that we have here.
Yeah.
So
Good. There are some cynics in this room that think value-based care is more marketing than substance.
Right.
That getting those contracts and getting meaningful value-based care that is not just sort of a fee-for-service under the hood is more talk than action. What do you think about that?
Yeah, I've heard that quite a bit over the last day or so as well, and I think there's some truth to that. You know, for us, we're with a Medicaid plan. We're required by Access to have really in some of our contracts over 50-60% of our dollars in a value base, but they're also giving us targets within that land framework. And so, you know, when you start at a land, you know, 1 or 2, and it's, you know, I heard Brian Davey earlier saying about, you know, paying just to get your claims in on time, paying just for some things that feel like a, you know, more of a basic concept, to really moving to this shared savings. We have some great partners here today, and really trying to look at it, but it's hard work, right? Yeah. And so to your point, it's what we found is we're good at getting to the shared savings upside. So we can get to that, we can kind of pull things together, to your point, we can kind of put something together that seems real meaningful, but we're a little bit plateaued, right? So getting to that next level of really downside risk, really transferring a lot of that work to the providers, and we really do support that concept. We know that you're going to get better care when the providers are deciding. We at the health plan don't need to be the ones deciding that. So I know for us, we reduced our prior auth list by a substantial amount last October, saying, providers, you know what's best, and as we move to value-based, we shouldn't be the ones dictating that. We need providers, you know, really owning that and really figuring out what's best. Yeah. But I would say that's something we spend a lot of time on internally, and we have some great partners who are definitely willing to jump with us and go, let's just figure out something that makes sense. But I do think for all of us, at least in Arizona, I feel like we're at a pretty good spot. It's just we got to get to that next level, and that's hard work and oftentimes a little daunting. So, but we're going to get there.
Yeah.
So.
Last question, just to throw some acronyms out, is one of the state's MCOs, REBA, DSNP plan. How can this group of folks help you as a leader and inform you about the future of your organization and the work you're doing?
Well, I'd say keep doing what we're already doing. So I see a lot of friendly faces here today and a lot of great partners. I think the key for us is the communication, is the partnership. We have lots of great conversations, sometimes easy, sometimes difficult, but those are how we continue to grow and learn. So I would just be thankful for the partnership we have today and ask that we continue that great partnership and collaboration. Awesome.
Lorry Bottrill, CEO of MercyCare, thank you very much. Thank you. Appreciate it.